back to Dr. Noah's YouTube update, and we're going to review some of the last week's type of interesting things that are out there. Now, some of these are kind of frightening and it's kind of scary, but you need to be aware. Knowledge is power, so this isn't to scare you, and we'll talk a little bit about some things that we can do on the next video. So the CDC has found this new super duper killer, vicious, wild, crazy type of E. coli that was over in Germany. You probably heard about it. They were trying to find out, was it from sprouts or meat and stuff like that. Well, now they've actually had 4 cases here in I think it was in Arizona. It's an E. coli 0104:H4. How's that sound like, not to be scary like that? All these particular type of diseases are due to overuse of antibiotics. Once again, there's always a war going on. E. coli, we don't think about it, but that's like that's a living thing. And they want to survive just like we want to survive with all their little children like that. And so everybody is, once again, created with different types of means of trying to adapt to different types of environmental factors. And so one of them is that back in the 30s and 40s, antibiotics came into play, increased, and we'll talk about that actually today on Don and Cindy's program about antibiotics and some of the myths about it. I mean, it's just incredible, the myths about that. Is that antibiotics, either it's a factor that's able to break or stop replication of bacteria or break down the cell wall so they die. And so those have been used, for sometimes legitimate reasons. But over the last 50 years, it's been everything on the earth. Oh, you got a little itch on your nose, antibiotics. You got a little cold, antibiotics. You got a little earache, antibiotics. Everything you go into the doctor, regardless, I sniff, antibiotics. Got a sinus infection, antibiotics. And we'll talk about how that's basically all BS, because antibiotics only work on bacteria. And this is maybe hard to follow, but there's other types of bad bugs out there like viruses, funguses, and yeast. And actually the most scary one is prions, which are actually not even living sources, just actually flipped protein and peptide structures. That's what mad cow's about, and that's a whole different type of disease. But so it only works on that. So if you have a virus, which is a cold, or you have like a sinus infection, oh, that's right. Mayo Clinic, it's been shown that over 95% of all those are due to what? Viruses and fungus. So antibiotics will never work, but that's a common thing. So every time you take these antibiotics that, once again, is inappropriate or misused, you allow those bugs to become resistant. And now that's what's happening here. All around the world, we're getting newer and newer strains, more and more what's called virulent, nasty bugs that really kill people with bleeding and dying. And you got the flesh-eating type of, staph on your hand that just have, you hear once in a while where it just basically just, it's like a horror movie, just devours the person's type of body, all thanks to the drug doctors. Thanks. This was kind of interesting. Baby boomers strained the city. Well, there's a big switch that's been occurring this year and last year, is that this largest group of older people are they're called baby boomers, which I'm one of, is moving into, and it's about 70, 80 million. I've seen different statistics about that large proportion. Well, if that group does the same thing as groups before, don't take care of yourself, just trash yourself, and then wait for the miracle doctors to take care of you. Well, once again, we don't have the money, resources, or the capability of taking that. So cities are freaking out because, these older people are going and they just don't have the resources to be able to help people fall apart. So very, very scary. Oh, here's a mind breaker as we care. Another waste of money, more research again. Let's spend another $30 million. Well, at least it's good research. It's from the Journal of American Medical Association, July 2011. One of the top 5 medical journals in the world, showing that healthy lifestyle is associated with decreased sudden cardiac death in women. This has been going on like that, but I guess it's better spent than spending about pretending that drugs are good for you and spending billions of dollars. This is a Harvard study used at a large group of what's called the Nurse Health Study, which is a large study that's been ongoing and lots of information. So they followed these women for over 30 years, and they found out that if these crazy women just did these simple things, don't smoke. Okay, that's not too hard. You don't have to climb Mount Everest to find an herb or something like that. You exercise 30 minutes a day. Okay, that's not doing a marathon. You don't have to run around the world. Body weight's normal, BMI under basically 25, and eat a Mediterranean diet. You're able to decrease 250,000 to 310,000 deaths per year for women by how much? 5%? Couldn't be 20%. 40%, man. If there was a drug that did a 40% reduction like that, people would be knocking down your local drugstore, paying any amount of money, and be able to get it. But just doing those 4 simple things was able to reduce those 250 to 310,000 by 92%.
Wow.
What's more powerful, drug or lifestyle? Once again, I've had a $5,000 offer for any drug doctor to come on. Let's talk about power here. There's no drug that even comes close to this. Yeah, sure, they make a lot of money, make a lot of side effects, but once again, that's the dirty little secret. This crap is crap. You believe the crap, you turn into crap. Instead of doing something that actually works and is effective. Lifestyle changes that once you learn how to do this, you don't have to see anybody to reduce these particular type of problems. So go and talk to your drug doctor on that one when they talk about the crap like statin drugs. Here's once again a compound called trochotrianols. This is a special group of vitamin E in this Ohio State University study published in Stroke, which is once again Drug Journal, July 2011, that this had a very, very powerful effect in preventing serious side effects when you do have a stroke in 3 different ways. We won't go into it. And what they were saying, this is more powerful. Once again, these are drug doctors. This is more powerful than any drugs out there. But once again, you're never going to hear this stuff because when you have a stroke, once again, that's hundreds of thousands of dollars that they make that should have never happened, or very simple, inexpensive type of thing instead of using these clot busters and different blood thinners and things that cost thousands of dollars a month. And here's something that from this particular study here from Stroke showed was more powerful than drugs because it worked on 3 factors. So if you didn't like lifestyle in terms of sudden death, how about blindness? Another study, Ophthalmology, July 2011. Yeah, lifestyle and macular degeneration there. So the studies keep going on. I mean, like I said, to me, I think that money should be better spent in actually helping people, but that's what science is all about. And the last one is just, Pfizer's stop smoking drug increases heart risk by, once again, so here we have doing natural things is able to reduce your risk by 92%, taking this drug to stop smoking. Now, granted, smoking is very, very dangerous, lots of side effects, #1 reason for death, but there's a lot of other natural things that maybe we'll spend a session on natural things. But this drug only increases heart risk by 75%. Nice, that's a good deal. So who cares? They make money, trying to make you stop the addiction oh, that's right. The drug doctors just 30 years ago said, oh, smoking is actually good for you. I got ads that go back, actually more than 30 years, back in the 1930s, I stand corrected there, showing that drug doctors saying, yeah, smoking is good for you. Everybody should smoke. It kind of makes you kind of tough. It's like we talked a little bit before, like a little radiation actually makes you kind of tough. Yeah, believe that. And I got some bridges over here in California, like the Golden Gate, I'll sell you for $10,000 in cash. Yeah, so there we go. Have a nice week.